This is a bombshell report, a 76-page preliminary report on the investigation conducted by the Office of the Attorney General here in New York, Letitia James, which found that the deaths in nursing homes and assisted living facilities of COVID-19 in the state were actually undercounted by as much as 50%.
By percentage, our loss was much, much less than other states. We've done a full study of it. The virus came into nursing homes from the staff. This is before we knew there was asymptomatic spread, before we had the testing capacity. But we always had additional beds for COVID-positive people. We had emergency hospital beds, additional hospital capacity. We never forced any nursing home to take them.
So, Governor,
it's just not true. Willie, I hate to get technical with you, but sometimes these things are technical. There was never a directive that said we will send COVID-positive people back to nursing homes. The directive, which was modeled on the federal directive, said you cannot discriminate. But the state law clearly says a nursing home can't accept a person unless they can treat them. Having said that, would my health department have followed the federal guidance? Obviously not, knowing the political issue it was going to create. For the president to create a narrative which is factually untrue, which causes pain, I understand his political reason. I mean, he needs some counterattack on COVID. But it's untrue and it's mean.
Well, I mean, your Department of Health wrote the March 25th advisory. So just to put a fine point on it, do you take any responsibility for the 6,600 deaths in nursing homes in the state of New York?
Well, look, I take responsibility for every death in the state of New York. I'm governor of the state. I take responsibility for every death. I don't care, frankly, if it's my fault, not my fault, if it's the federal government, if it's God that did it. I'm responsible, I'm in charge, and I've never run away from that.
There has been a lot of confusion about an alleged March 25th order that directed nursing homes to accept, in New York, infected COVID patients, possibly leading to the death of more than 6,000 seniors. Now, you say in your book that that was a lie, that New York State never demanded or directed that any nursing home accept a COVID-positive patient. The Department of Justice, however, is now supposedly looking into this issue. Can you explain what really happened?
Yeah. What a shock that the Department of Injustice sends a letter a few days before an election trying to advance a political theory. I was shocked and amazed that the Trump administration was capable of such a thing. Sonny, they have played politics on this from day one, right? They have done a terrible job on COVID from day one, and they want a counter defense. And what they were saying was, well, a lot of people died in nursing homes in Democratic states. It's not just New York, it's all the Democratic states. And the truth is, a lot of people did die in nursing homes in Democratic states. The conspiracy they're trying to spread just has no factual basis.
We had more people die than any other state. That's a fact. The reason that happened was because we had the virus coming from Europe when the federal government told us the virus was coming from China. And we had no screening on people coming from Europe. Now, the federal government just missed that. In New York, we're number 46 in the nation in terms of percentage of deaths at nursing homes compared to the total percentage. By the New York Times, we're number 46. So it's been unfortunate in every state. We have to do more. We have to figure it out. But if they want to point fingers, not at New York. We're number 46. You have 45 other states to point fingers at first.
Yes, we had more people die in nursing homes than anywhere else because we had more people die. Because the federal government missed the boat and never told us that this virus was coming from Europe and not from China. And January, February, March, before they did the European travel ban, 3 million people came from Europe and brought the virus to New York. And the federal government didn't know, and the federal government and the CDC and all of them failed to handle this pandemic and warn this nation. So New York had more cases, more deaths, and more deaths in nursing home because that's who the virus affects. It affects senior citizens. We know that. You look at any state, and they had a tremendous number of deaths in nursing homes. It's all a political charade, and it's an ugly one, frankly. Willie, I hate to get technical with you, but sometimes these things are technical. There was never a directive that said we will send COVID-positive people back to nursing homes. The directive, which was modeled on the federal directive, said you cannot discriminate. But the state law clearly says a nursing home can't accept a person unless they can treat them. Having said that, would my health department have followed the federal guidance? Obviously not.
And we never needed nursing home beds because we always had hospital beds. So it just never happened in New York where we needed to say to a nursing home, we need you to take this person even though they're COVID positive. It never happened. We had extra beds. We had extra beds at Javits. We had extra beds at emergency hospitals that we put up all across the state. So it just never happened that we needed a nursing home to take a COVID-positive person. It never happened. No, I wouldn't do an investigation as to whether or not it's political. Everybody can make that decision for themselves. I think you'd have to be blind to realize it's not political. Just look at where it comes from and look at the sources and look at their political affiliation and look at who wrote the letter in Congress and look at what publications raise it and what media networks raise it. It's kind of incredible.
He worked it out so we always had available beds. Nobody was deprived of a bed or medical coverage in any way. And still people died. Still people died. Older people, vulnerable people are going to die from this virus. That is going to happen, despite whatever you do.
The report also found that nursing home facilities lacked proper PPE as well as testing for COVID-19, which led to the increased risk risk of death of those people in these long-term care facilities. The investigation also found that some nursing homes are to blame, too, for their lack of compliance and poor service. More than 20 nursing homes are now under investigation. Also, in terms of the undercounting of deaths, in the investigation, there was this example. Take a look at this. In one example, 11 confirmed or presumed deaths were counted in one nursing home. The actual number of deaths were 40. More than 8,000 people have died of COVID-19 in nursing homes in the state. That is the official count. But families have long suspected that the death tolls were far larger than that. Remember, more than 42,000 people have died of COVID in New York. That's the largest number in the country. Now, under Governor Andrew Cuomo, the state was only counting those who died of COVID-19 inside the facilities. They were not counting those who died of COVID-19 while they were at the hospital. The state also found that the March 2020 New York State Department of Health guidance to nursing homes and long-term care facilities requiring them to accept COVID-19 infected patients that were just released from the hospitals may have increased deaths. And this is despite Governor Andrew Cuomo's claims that they conducted a study that found that there was no correlation between that DOH order and the number of deaths. In a statement in the release, it says, quote, government guidance requiring the admission of COVID-19 patients into nursing homes may have put residents at increased risk of harm in some facilities and may have obscured the data available to assess that risk.
Remember, this governor wrote a book about how well he did in the pandemic response. It became a bestseller, and then he won an Emmy for his briefings.
For briefings.
And now you have families who they weren't there to be able to hold their loved ones' hands. They weren't able to have a funeral, and now they're finding this out.
What Brian's reporting at the end there is important to emphasize. These were COVID patients who were being treated at local hospitals here in New York. And the order came out that said, once they're released from the hospital, the nursing home must take them back in. Well, these nursing centers with all the elderly, they were the most vulnerable of all at any point in COVID-19, especially during March and April of last year.
We're grateful that across the country there are responsible leaders who are stepping up. One of them provided clear direction and memorable PowerPoints. New York's Governor Andrew Cuomo.
I heard, though, that you had a crush on our boyfriend, Andrew Cuomo.
Dude, everyone does, right? I think he's fantastic.
You know Cuomo. He even had a 70% approval rating in April with Republicans. Why? Because he was leading.
Even lifelong Republicans tell me, they look at Cuomo and they're like, God, there's a leader.
Governor Cuomo, who has been a leader in calling for science-based ways to fight this coronavirus. The Academy says that he's being recognized for, quote, his leadership during the COVID pandemic and his masterful use of television to inform and calm people around this world.
Tonight, what we can see from Democrats, especially someone like Andrew Cuomo, is a really pointed prosecution of President Trump's handling of the virus.
I commend, Governor Cuomo in taking some of these steps that they already have in limiting capacity.
I mean, I'm so turned on by him. I'm so turned on by the leadership. I have feelings for Andrew Cuomo. I wrote a piece about it.
Having heard you day after day after day at your press conferences, I have to wonder what it's like to be in your shoes with the weight of this responsibility and just the sheer exhaustion you must be feeling right now.
We're lucky now to be joined by Governor Cuomo.
Governor Cuomo is joining us now. His new book, by the way, is entitled American Crisis Leadership Lessons from the COVID-19 Pandemic.
I hope you are able to appreciate what you did in your state and what it means for the rest of the country now. I'm wowed by what you did, and more importantly, I'm wowed by how you did it.
So you just do what's right. I did what was right. I'm comfortable with what I did. I think the facts bear it out. I think the numbers bear it out. I think we saved tens of thousands of lives, but I did what was right.